Hi guys, so this is Anna. So we are going to be talking about central lines today. And right now I'm actually going to talk about this famous apheresis catheter we've been talking about here. We've been seeing patients with it, and we're going to see it a little bit more now because we're seeing OPD patients, and we may even see them here in the ops unit too, because just our population is changing. So what's an apheresis catheter? It's a large non-tunnel catheter that usually is there for a long time. So patients need it for either medications, transfusions, and whatnot. So usually you will see patients with the dressing and their catheters. And one of the more important things that you need to be aware is that these catheters usually have high dose heparin. What does that mean? It just means that once you're done doing whatever you're doing, you need to leave heparin in the catheter. And it has to be more than 500 units. Usually it's like 1,600 to 1,900 units per lumen. So if you had 2 lumens, if say for example it was 1,900 units, then you would put 1,900 units in one lumen, 1,900 on the other lumen. Okay, so that's the biggest difference from just the regular picks that we've been using. The other thing too, what are some of the supplies you need? You would need your CVC kit that we have in our central supply. So this is what you would need. The CVC kit pretty much has everything, has a mask, has gloves, all of that. The other thing too that you would need is your saline flushes, your green caps, alcohol prep pads in case you need. And if the patient is allergic to the chlorhexidine swab, then we would be using 3 betadine swabs and then 3 alcohol swabs. Which one do you do first? The first thing you use will be the alcohol, and then you use the iodine swabs. Got it? Okay. So we have Chester here. And it's time to do a dressing change, and then we're going to access the catheter as well. So the first thing we're going to do is, once we clean our hands, we're going to don gloves, we're going to remove the dressing change, and then discard all we need on our trash can. So the first thing we need to make sure is that we have everything set up. We have our supplies, we have the trash cans. Now because I'm right-handed, that's why the trash can is on the right-hand side. Okay, so the first thing when you open the kit, it's going to give you the hand sanitizers and the gloves, and I already did that. The next thing is I'm going to do the other part here. I'm going to don my mask, and it actually comes with 2. So you see that it comes with 2 masks, and you're wondering why does it come with 2 masks? One's for you and one's for the patient. So the patient needs to have a mask. And then when you're actually doing the dressing change, make sure that you let the patient know that they need to face the other way, so that we're trying to prevent as much bacteria exposure to the site. So I will put on my mask. Okay, and then Chester has his mask. I will don my gloves, use my antiseptic already here, so it saves me a step from walking to the room. And of course, we have to make sure that it's all dry, and then this will go in the trash. So now we would clean the area vigorously for at least good 15 seconds. Make sure we clean the line here, make sure it's nice and clean. At the same time, we're assessing the area Is there any drainage? Is there any inflammation, redness, skin irritation? Once we let it dry, remember we're not going to be fanning or blowing at it. We're just going to just let it dry naturally. Once that's done, then we would use then our no barrier film, the no sting, and this just allows it for the dressing to stick there longer, and it protects their skin as well from the adhesive from the dressing. So then you would make sure that you would apply around the area. You will let that dry as well. Once it's dry, then it's time for us to apply the dressing. Before we apply the dressing, we need to make sure that we have the 3M ring. Okay, so we are going to peel the first part. And so it is going to fold nicely like this. And we have to make sure the catheter falls right on that edge right here. Okay. Now we're going to pull the other sticky out. We'll save that because we're going to need it. And then we're going to pull this one as well. And we're going to need this as well. So now we're going to use this part because as you see the little groove, this has to fall right under here. So that's kind of your guide. So you peel it off, you grab the little parts here, and then you will put it right under that. And you will add some pressure. Remove. And now we're ready to put the last part where you would date it. And then you will apply right on top of it. This makes sure it's secure and it doesn't come out. Okay.